So, Dr. Smith, after someone has gone through bariatric surgery, they have a wound that they have to care for. How might they do that? And what are some special considerations they might want to have, or some tips or tricks in order to make sure that they heal the best the way they can?
So when you go home, you probably have one of two kinds of wound dressings. First of all, you most likely have 5 small incisions on your abdomen. Those are from where your minimally invasive surgery happened. And then most of my patients go home with a Dermabond on their skin. That looks like skin glue. Some patients will have a clear plastic dressing under which there is a piece of gauze. If you have a clear plastic dressing with some gauze under it, those should come down on the second day after surgery. Underneath that gauze, they'll find little pieces of surgical tape that we call steri-strips, and those can stay on. Those usually fall off by around the 10th day after surgery, and if they haven't fallen off by the 10th day after surgery, then patients can go ahead and remove them themselves. Some patients are not excited about that, and if you want to leave them on and let them fall off on their own, that's also safe. If you have the skin glue dressing, you don't have to do anything. It is just slowly going to flake off over time. Usually it stays intact for a good 10 days. It will start to change color. It will start to look a little bit like rubber cement. You can just keep doing nothing. Leave it alone, and it will come off on its own. Either way, you're okay to take a shower. Don't scrub the incisions. Just scrub your chest and let the warm, soapy water wash down over your abdomen. When you get out of the shower, then you want to pat those incisions dry. Do not rub them. I don't want you to soak them in the tub. So you should not be sitting in the bathtub with your incisions submerged. And you shouldn't submerge your incisions in any body of water for at least 3 weeks or until the skin is completely healed and closed. And that means no swimming. Don't get in a pool. Don't get in a hot tub. Don't get in a lake or a river or the ocean. Anything that would submerge your wounds would be something you shouldn't do. Once your skin incisions are completely healed closed, then those activities would be safe. And you can also take a bath at that point too.
And so I imagine that the area is going to be affected. There's going to be some bruising, there's going to be some itchiness and those kinds of things. Like, what would you suggest to people in the audience, things that they can do or things to look for? What's okay, what's not?
Yeah. So if you have any drainage from your incisions, that's something that your doctor is going to want to know about, especially if the drainage doesn't smell good. If your incisions start bleeding, that's something that they would want to know about. But there are many things that happen with these incisions that are really normal. Bruising is fairly normal. When you have these small incisions, we operate through these tiny ports that are plastic tubes that go through your abdominal wall, and those are moving around. During the operation, they can cause some bruising. So that's how that happens. It's also very common for these incisions to start itching. They can especially start itching about 2 weeks after surgery, and that can go on for even sometimes up to 3 months after surgery. Resist the urge to scratch them. That can lead you to a surgical site infection or an infection where these incisions are. What I think works is if you take a terry cloth towel and you just gently rub the area that's itching. That will be soothing without being abrasive to the skin incision and can get you through those itchy times.
For the wound itself, over time, over the course of a year, I mean, is it good to stay out of the sun, or can I expect discoloration? I mean, what's going to happen? Yeah,
you do want to stay out of the sun. As the skin heals, it will be sensitive to something called hyperpigmentation. So it's normal for the incision as it heals to be a fairly bright red color, and that's going to fade. But it takes a long time to fade. It can even take up to a year to fade back to your normal skin tone. I want you to keep those skin incisions covered, because if you don't, then they can get hyperpigmented. So they'll end up darker than your regular skin tone, and then they'll really stand out. So we want them to just blend in with your normal skin tone. But that process takes a year, and you do need to keep them covered and protected from the sun. The other thing that I want you to know about your skin incisions is that people like to put ointments on their incisions. Try not to put anything on your incisions. Just wash them with soap and water like you normally would in the shower, pat them dry, and otherwise leave them alone.
Hey folks, connecting with your benefits is our primary mission, and the SITREP is providing more options than ever.
Subscribe to our free email newsletter, subscribe to our audio podcast channel, or subscribe to our content on YouTube.
For details and links, check out the description below.